Here, is she perfusing her brain?
So he's stuck in and all.
Here, is she perfusing her brain?
So he's stuck in and all. Times of returning of something like 2 5. So he's stuck in and all.
This is Jim Chowdhury. He's 56 years old. He presented into the ED after an episode of chest pain, and he was walking his dog, and his neighbour happened to be around and called an ambulance, so that's good. He has a background with a father who's recently passed away from heart-related concerns, so he had myocardial infarction, but he has no other family or but he does have a wife. His wife supports him at home. So he was complaining of a crushing heart and chest pain that radiated up into his jaw and arm. On arrival, his obs were, his temp was normal. ECG was done and bloods were taken. ECG showed some abnormalities in the ST segment. And we're currently waiting on a cardiology review with suspected angina and coronary artery disease. We're also waiting on the results from the blood and some medication to be prescribed. Jim, do you have any questions or anything else you want to add?
Here, is she perfusing her brain?
So he's stuck in and all.
Here, is she perfusing her brain?
So he's stuck in and all.
Casey, I'm just another nurse. We've just got all your results back about, your angina that you have had and your chest pain that you came in with. So the doctors have just told us that you've got coronary artery disease, so they'll be coming in later just to discuss it some more with you. But pretty much coronary artery disease is, it's just a build-up of the plaque inside your coronary arteries. So since he's come in with that angina and the chest pain, that's usually a factor, and which is why we looked into it. And it just settles there, and then it hardens and narrows those arteries, and then that's what we call atherosclerosis, which is what coronary artery disease is. And then these may lead to some more serious problems, such as your heart attacks, your strokes, and then so that's why we just got to keep an eye on it and make sure that we manage it properly. It's usually just caused by the build-up of cholesterol-rich deposits on the walls of the arteries, and that's when it hardens, and so there's obviously less blood flow to your heart and causing less blood flow everywhere, which is our major concern. So the symptoms were the chest pain, and even though it's a vague symptom, that's why we look into it, just because it is so vague, so we might as well. So normally your arteries, I do have a picture here for you, so that just so we can have a little bit more description. So normally your arteries are nice and clear, Jim, with no deposits. However, when you've got your coronary artery disease, as you can see, there's the build-up around. So that's just what yours will look like. The severity is to be determined. So the chest pain that he was having and the angina, that's what's been diagnosed as it, is ischemia, which is when there's reduced blood flow to the heart, so the inadequate supply, there's not enough, and that's due to those narrowing of those arteries. This is where the pressure may be felt in your chest, and that's how it's radiated up into his jaw and down his arm, and that crushing feeling. Then he might have been feeling weak at the time, which is why he was on his knees. Sweaty, he's short of breath, that's why his increased respiratory rate, and then his heart rhythm also changes, which is what we saw on the ECG, and we also saw you had an increased heart rate, which is all just to do with your ischemia. They can continue to have issues with the contractile motion, but hopefully with all our medications that we'll prescribe him, she'll calm it all down.
Excellent.
Yeah, and then just a few risk factors. So people with coronary artery disease, usually there's an underlying problem, and those risk factors could include abnormal lipid levels if he's a smoker, abdominal obesity, the hypertension, regular alcohol use, a really unhealthy diet, and then just the psychological stress. So all these things can then lead to something more serious, depression, which I'll give you a brochure about. So please just take home and read it. And if you do have any concerns, especially you as his wife, just keeping an eye on it. Yeah, so just any concerns, call the helpline, talk to your GP.
Thank you.
This is just another one on coronary artery disease, just helping you out, talking about what it is, a bit more further explanation of it all. So yeah, that's all that I'm going to tell you about it. Like, if you have any other questions, just let us know. And another nurse will come in and talk about some long-term management.
Seeking here is she perfusing her brain.
I'm here as one of the nurses today to talk to you about the medications that the doctors have prescribed. So I know they've given you 4 and kind of said the big long names and then just run out of the room. So I've got some pamphlets about the different drugs and about education and what you should do when you're taking them and about the risks. So you're prescribed the ACE inhibitors, the GTN, the statins and the beta blockers, and they all sound big and fancy, but we'll go through them. So
Seeking here is she perfusing her brain.
He's stuck in and all. Times of between of taking like 2 to 5. He's stuck in and all.
the first one, the ACE inhibitors, that's a tablet that you take once a day, and it decreases your blood pressure by decreasing the amount of fluid in your body. And so when you take this, you've got to be careful the first time you take it, in the first roughly 12 hours, because it can drop your blood pressure and make you a bit dizzy and things. So if you're driving or operating heavy machinery, then you could be a risk to yourself or others. So that's something to be aware of.
I'll have to do the driving.
And also the diuretic effect, so it makes you go to the toilet more. You've got to be conscious about your surroundings. And so if you're in the shopping centre and you've just taken the medication, you might want to keep an eye out for your toilet. But also because it is a diuretic, you can be a bit dehydrated from it. So make sure you keep your water intake up, and if you do a lot of exercise, then replenish your fluids. And one of the main adverse effects of this is that you can lose your taste sensation just for a little bit, or have like a metallic taste. But that should go away in 2 to 3 months, but that's something we can monitor. And because it's dropping your blood pressure initially until your body gets used to it again, you can feel a bit dizzy and things. So just kind of be aware and careful when you're walking downstairs and things. And with your diabetes, you'll need to check your blood glucose levels a little bit more often. So it will decrease your blood pressure, but you can also have some palpitations, so like you feel your heart beating. You can feel a bit dizzy, like I said, a little bit of nausea and vomiting, or a persistent non-productive cough. So it means that you're always coughing, but when you cough, nothing comes up. Or a rash on your arm. But these are the sort of things to let us or your GP know about. So that's the first little information booklet.
Seeking here is she perfusing her brain.
He's stuck in and all. Times of between of taking like 2 to 5. He's stuck in and all.
And then the next drug, the GTN, is the spray that you spray under your tongue. And so that is a reliever medication. So when you're having your angina attack, you just spray it under your tongue and then shut your mouth quickly.
So it doesn't take that all the time?
No, it doesn't take it all the time, just when necessary. So it increases the blood flow around your heart. So I know you know that angina is reduced blood flow to the heart, which is what causes the pain. So this will open up the vessels and let all the blood back through. With this medication, because I know that you're using Viagra, you'll have to stop that. I think the doctors mentioned it to you. Yeah.
Oh, no.
So we'll come up with alternate therapy for you.
Okay.
But if you take the Viagra, then it can have an interaction and cause your blood pressure to drop too low, and then you can have serious effects. So when you're first using the spray, you've got to prime it first. So you spray it 5 times, and that gets a nice even flow out. And then if you haven't used it in the past week, you prime it with 1 more spray before you use it. And if you haven't used it for about 4 months, then you do 5 sprays again. But that's all in the booklet I'll give you. And you need to let your doctors know if your angina attacks are increasing in number or the medication isn't working as well, and then they can reevaluate it. So it's important that you keep the little spray bottle with you at all times, because if you have an angina attack and supermarket, you don't want to be running around back to the car to try and get it, so calm it down. And we recommend that you sit down when you take it because you can feel a bit dizzy, and that will also relieve the effects. And make sure you don't just like spray it into the air and sniff at it because it's effective through the under your tongue. And some adverse effects that you can have because of the spray is a throbbing headache, flushing of the face or neck, dizziness, or some nausea and vomiting. So that's another booklet.
Thank you.
Seeking here is she perfusing her brain.
So Stacey, you stuck in and all. Times of retaining of something like 2 to 5.
And then the statins, which is more tablets for you. So you take those once daily as well. And the statins help reduce the cholesterol levels by preventing your cells from creating more cholesterol. So it just means that the cholesterol levels decrease. And we have to warn you about consuming alcohol while you take them because it can increase the damage on your liver. So it's probably best to avoid a frequent beer. And also while you're taking it, you'll have to have a lot of blood tests and they just measure the levels, but your GP will organise that, but you'll be in and out and being prodded and poked, but it's all to look after you. And you need to avoid grapefruit juice because it has an interaction with the drug and can hinder its effect. Yes, I know grapefruits or the juice or any juice in the lollies and things. And then some adverse effects, again, is a non-productive cough, so a cough that doesn't produce sputum. Which is the same as your ACE inhibitor, some nausea, some fatigue or back pain. So that one's there, more information.
Seeking here is she perfusing her brain.
So Stacey, you stuck in and all. Times of retaining of something like 2 to 5.
Yes, and then the last one is the beta blockers. And you take these 3 times a day and they reduce the body's response to adrenaline. So that means that instead of your heart rate increasing and your heart having to work harder, it will decrease the heart rate and limit the force of contraction. So it just lets your heart relax a little bit more. So with these medications, it's important that you don't just stop them abruptly because it can cause side effects and your angina will get worse. So you've got to make sure you take your 3 a day. And with your diabetes, you've got to, again, make sure you take your blood glucose levels more often. And also, if you have a hypo attack, then your recovery time can be a lot longer. And you can have symptoms that kind of hide away. So just be very aware of your diabetes. You need to make sure that you swallow the tablet whole because if you crunch it up, then it won't work as well. And some adverse effects are tiredness, headaches, upsets with your tummy. And these are quite frequent when you first start taking the medication, but they should sort of go away. And then some less common ones are you'll get a reaction to it, or you'll get cold arms and feet, cold extremities, and your heart rate will decrease, but you'll still have palpitations or double vision, but they're less likely. And there's the final booklet. So I know that's a lot of information, but it's all in the booklets again, so you can read it at home.
My name's Hannah. I'm one of the nurses caring for you. So I'm here to talk about the risk factors that you've got of CAD. So your 4 main ones are smoking, hypertension, diabetes and your body weight. So in terms of nursing interventions that we're going to do,
Seeking here is she perfusing her brain.
So Stacey, you stuck in and all.
first of all, with smoking, I understand that your smoking has increased since your father's death. Yeah, I can understand that, but it doesn't really help the severity of CAD, so if at all possible, we're going to try and reduce it. So there's a couple of ways we can do this. You can do it through coaching, where you have a guidance counsellor and they help you remember your reasons for quitting, set you reminders, give you constant motivation. That might be over the phone or through counselling. You can go to your GP as well and talk to them about that. There's another option as well of nicotine replacement therapies. So that involves things such as nicotine gum, patches, nasal spray, lozenges, and so that assists by withdrawing the symptoms of cravings and reduces irritability and things like that, but it doesn't have the harmful effects that smoking does. I have a flyer all about the risks of smoking and CAD. See what you think would suit best.
Speaking here, is she perfusing her brain?
So he's stuck in and all that.
Speaking here, is she perfusing her brain?
So he's stuck in and all that.
Yes. So hypertension is a high blood pressure. It's abnormal. Essentially, it just puts greater pressure in the arteries, which can lead to things like CAD. To deal with this, we first go about it through things like lifestyle factors, so your diet, level of exercise, and that sort of thing. So I understand that you've changed your diet and exercise recently. It's a good start. So for the diet, we mainly need to avoid things like excess sodium and salt. Take any more than 4 grams of salt a day. You also try to have a plant-based meal with lots of fruits, lots of vegetables, whole grains and things like that. Limit the level of cholesterol and fats and that sort of thing. Exercise is also really important. So you need to get approximately 30 minutes a day, but considering that he was doing half an hour of exercise every day, wasn't he?
Yes, walking the dog. And,
Yeah, so because that's what actually set off his angina attack, we're going to look at reducing that a bit. So he may still do 30 minutes a day, but maybe instead of in one big hit, maybe you can break it up into 3, so 10 minutes in the morning, at lunch and in the evening, or however you'd like to do it, just so that there's less strain and less problems or the potential to have another attack.
Speaking here, is she perfusing her brain?
So he's stuck in.
Then when it comes to his body weight, so he has quite a large BMI and a big waist circumference, so you know what those are?
So BMI is height and weight.
Yeah.
Ratio and reference.
Yeah, so it's just a general scale of the level of obesity. So in Jim's case, he is considered obese. And then waist circumference just measures the amount of fat around your waist. So we also need to look at losing weight. That's also
We
done.
can do that together.
Yeah. So that would provide good motivation for him. So it would be similar to the hypertension in that you have a good diet, provide decent nutrition, continue to exercise. It is going to be a slow process, but we just have to try and get that down. If this doesn't continue to work, then we can look at medications or even in the future surgery. But for the moment, we just want to see that, well, if the new diet and the exercise is having any effect, and if not, then we can further go on to that.
Sounds like
And then diabetes, so having been diagnosed, I'm sure you know what I'm talking about. So with your new exercise and new diet and exercise regimen, it's really good. So mainly we just have to keep up with that. Being type 2 diabetes, he doesn't need any medication as of yet. So it mainly is just maintaining a healthy lifestyle, maybe finding social support and finding groups or even counsellors that he can also go talk to, that sort of thing. Mainly it's just making sure that he tries to keep these lifestyle changes in check. He also will need to monitor his blood glucose just to ensure that we have kept it in the normal ranges. But I'm sure you already know this anyway.
We
So-
prick our finger a couple of times a day and
Good.
check out, make sure it's in the right range.
Excellent. So here's some flyers on hypertension,
Thank you.
diabetes and body weight. So the reason why we're doing all of these interventions is that all of these they increase his risk of the severity of CAD and multiple other things. So smoking, it decreases the availability of oxygen in his arteries, and so that puts more strain on the heart, which also doesn't help. His blood pressure and heart rate also increase due to the nicotinic acid in there. The coronary arteries can also constrict, which means that there's less availability of room for the blood to flow through. So as you can imagine, these all make it much worse for him. The hypertension also increases the risk of his CAD, and this risk increases as blood pressure increases. So the more we can lower it and keep it within normal ranges, the better. then your diabetes as well. Those with diabetes, they have a double the risk of CAD, so controlling that is also vitally important. And the body weight also is associated with increased blood pressure, abnormal cholesterol levels, insulin resistance, which of course isn't going to help diabetes, and platelets, which is part of the blood clumping together. So this only further increases it. And since he has a waist circumference of 102 centimetres, he is at even further risk. So with all of this, the more that we can lower these risks, the less severe his CAD is likely to be.
Okay. So motivation.
Exactly. So the main problems that we could come across, particularly are lack of motivation, going to a change of new lifestyle, diet, exercise, etc. He may find that he doesn't want to continue. So the best thing to do is just try and keep the motivation up, even if this is counselling, talking to you, going to your GP. There are several websites and call lines that you can call on those flyers in case this does happen. Also, he's having medications for his hypertension.
Yes, that's
Is
right.
he? Okay, cool. So you just need to ensure that he continues to take this and that he's compliant with taking these medications and sticks to the routine so that we can keep it within the normal ranges.
Okay.
So do you have any other questions? Just read those brochures in your own time, and if you have any further questions, don't hesitate to contact one of us or your GP or anybody else.
Thank you very much.
Looking here, is she perfusing her brain?
So he's stuck in and all.